Health officials in Buncombe County are trying to stop a trend they say is putting the community at risk.
Now, the health department says that more children are not receiving all the required vaccinations. In fact, Buncombe County has one of the highest immunization exemption rates in the state. News 13's Megan Shearing joins us with this special report.
Out of nearly 2,700 kindergartners enrolled in Buncombe County this year, 113 did not get vaccinated because of a religious exemption. For some parents, deciding whether or not to vaccinate their children is tough, and more families in Buncombe County are opting not to vaccinate.
Because he was at home most of the time and we didn't really get out a lot with other kids and stuff when he was really young. He wasn't really at risk for a lot of the diseases that vaccinations help to guard against.
This mother, who wants to remain anonymous, says the growing trend is why she wants to raise her family in Asheville.
There are a lot of parents on an alternative type schedule or that aren't vaccinating at all.
Many parents believe their children are being exposed to too much too soon. But health officials say that's not true.
We have to remember that every day, every breath we take, we are exposed to different allergens and antigens, and the amount in one vaccine is so minuscule, so tiny compared to what we come into contact with on a daily basis.
The biggest concern is the higher the number of unvaccinated children, the higher the risk of disease in the whole community.
California currently is in the midst of one of the largest measles epidemics they've had. New York State is having a measles outbreak, and there's a large mumps outbreak in Ohio right now. And it's all because of high rates of unvaccinated children.
State law allows parents to seek vaccination exemptions for religious or medical reasons, but it's the religious exemptions that are skyrocketing.
When we see our exemption rate increase close to 5%, we get worried that we are opening the door to these diseases.
Health Department records show there were just over 1,000 religious exemptions in North Carolina this school year. 113 of them were Buncombe County kindergartners. Other western counties are seeing an increase in religious exemptions too. 7 kindergartners in Haywood County were not vaccinated. That's up 5 from last year. And Madison County schools had 3 exemptions, 1 more exemption than last year.
I'm very concerned about the increasing numbers of students in our community who are not immunized.
School nurse Tracy Armstrong says she's seen firsthand what can happen to a child who is not vaccinated.
I've seen 2 tragic deaths, and these 2 have had such an impact on me. One was a 4-year-old who died of tetanus. This was the type of thing where her whole face was contorted. She was in terrible pain. The expression on her face is just locked in my memory, the fear and the pain that she experienced through this terrible disease.
But another local mom says childhood vaccinations poisoned her son, Kit.
My son's vaccine injuries are mostly neurological damage. He has been considered autistic, mentally retarded. He has encephalopathy. He has a lot of gastrointestinal problems.
Amy Carson uses her website, Moms Against Mercury, to raise awareness of the dangers of certain types of vaccines.
I would gladly turn back the clock and deal with measles, mumps, rubella, chickenpox every day, every week, than deal with what I have to deal with every day with my son.
Carson says she's not telling parents not to vaccinate their children. She just wants them to do their research before making any decision.
I do give them the information that was never made available to me. I feel that parents have the right to research and make some good decisions for themselves and the health of their children.
Good advice the first mom we spoke with is taking.
We're always evaluating our stance on it, I guess, just trying to make sure that we're doing what's right for him and also trying to keep in mind the general public.
The health department says they understand parents have concerns, so they encourage them to speak with their health care provider. Back to you.